Hello, Notes community. I'm back and I'm here to drop the requested teaser about connecting with that client of yours and some of the ways that you can kind of transition a traditionally cold client to someone who could potentially be your next client or a warm client. So I'm going to walk you through the steps. So for most of the video here, I will be somewhere here in the corner. But I wanted to, one, give you guys the opportunity to ask any questions. And then if you have questions, I'll jump back on this same video and answer them. But feel free to walk along. So I'm going to kind of move a little bit slow so that you can get the opportunity to walk along with me. So like I said, welcome, welcome. This video is specifically for nurses who are interested in some of the tips and tricks that I use to get access to clients, their name, their information. It's out there. And turn a potentially cold client into a warm client and possibly your next client. So let's get started because we're going to go ahead and jump in. And as I've talked about in previous videos, I typically use Medicare.gov. And I'm 100% an advocate of LinkedIn too. So those will be the two websites that we'll be focused on today. And then, as I mentioned in the video, I think that video is probably 2 years old. You want to connect in person. Like there's nothing like connecting with people in person. There's nothing like, reaching back out to old supervisors or friends of friends who are supervisors, DONs, to get access to potential contracts. And when we talk about contracts in this particular scenario, we're really talking about your direct contracts where you provide direct staff to that particular facility or healthcare system. So let's get started. And we're going to start here at my favorite website, which is Medicare.gov. So if you want to walk through with me, you feel free to do so. So at Medicare.gov, it has all the information you need to get things going. And this process or this step in the process still is applicable. So I always go to find providers near me. And then of course, it allows you to select your current location. It allows you to select street, zip code, city, or state. So for these purposes, because we had to do a test one, we're going to use the city and state, and it's going to be Salisbury, Maryland. I encourage you guys to use cities and states that you're interested in, or zip codes. Any of those work. And you have the option from this point to either select the provider type here from the drop-down menu, or just click on one here. And for these purposes, because all of these types are applicable, but for this particular video, we're only going to be focusing on nursing homes, including rehab services. So we're going to click that one. Search for nursing homes in Salisbury, Maryland. Yep, that's what we want to do. As I mentioned, a lot of this stuff could be repetitive if you've seen the other video, but we're going to follow it as if it's new. So I'm going to give a little bit of information and then I'm going to actually get into what we're doing. So a little bit about the STAR system. So the best way to explain it to people is it's similar to Yelp. So 1 star is meaning you're having a lot of problems. A 5-star is meaning you're doing fantastic. All healthcare facilities that we saw listed in the previous page have to meet specific requirements from the state level and the federal level, meaning that they receive monies from the federal government to provide care and services to Medicare, Medicaid patients. And on a yearly basis, we usually see it or refer to as a term of the states in the building where they do health inspections, they audit charts, they do, they have conversations with patients, they talk with the directors and administrators. And from those conversations, they do a report, and you can see copies of it here. We'll take a look at one here. And from that report and specific criteria that they have to maintain, they come up with a STAR system. And from the STAR system, they determine that either the facility is below average, much below average, or above average. So these 3 are really great ones because they have different things going on. They're all listed in Salisbury, which is kind of our geographic area that we see listed here. But let's jump into what you can find out if you want to that might be happening at the particular facility. And then I'll talk with you about how you can use this information to get access to your next client. So let's take a look at Anchorage Healthcare Center. They have an overall rating of 1, which is the lowest you can get. And then as you look here, the ratings are broken down into 3 different categories that it touches on. You can click here to see how Medicare calculates the ratings. Like I said, there's 3 different categories. As you can see right here, guys, staffing is one of the categories. So one of the reasons that staffing that is beneficial to NOSAs, that staffing is one of the categories, is that we can just click here and get in more information about their staffing levels. So it kind of talks here about pay, number of hours, number of staff members by title, weekends, staff turnover. So it gives you a lot of good quality information about what's happening with that facility from a staffing standpoint of view, along with the health inspections. This will usually include things around safety, fire safety, food, those types of things. And then quality measures are really around, charting, quality improvement types of things and mandates. And then of course they have some information around COVID, any penalties, any other major issues, along with the address of the facility and the phone number. And now they have a cute little map here. So this facility is actually right outside of a medical center, which is always a good thing. So let me tell you how I use this to reach out to clients. So traditionally, 4 or 5 years ago, this information would be used to say, hey, they have a 1-star. You can go as far as checking on Indeed to see if they actually have job openings. And that is something that you can use towards your sales pitch. But if they have a 1-star for staffing, 9 times out of 10, they need staff. So reaching out here, if you're local, so like if I was in Salisbury, I would definitely go up to the facility just to check it out. You don't have to do a tour, but you definitely want to check it out, check out the location, what's near it. Like I said, the picture at the bottom kind of gave us a little synopsis. So it's near a medical center. So I'm guessing that a lot of the people that are being discharged to this medical center that aren't going home will be sent or have been sent over to this particular facility. They also have business information on here, which is fairly new from the last time I did this presentation. So this is information about the owners. So these are great things to Google. So you get a chance to say, hey, the owners are this, you can look them up, you can get some information about them, what might be happening, what might not be happening, and get a chance to see if they're having any financial issues, which can also be a challenge for NOSAs when working with potential clients. So that's something separate. So we'll definitely touch on that at a later date. And we're actually going to print that because I'm going to talk about that. So with that information, I would typically go out to the facility, check it out, and then use this phone number to place a call. The question comes up often from many people around, well, who do I ask for? How do I know who to ask for? And that can be tricky because not every facility is set up the same. I believe on this page, you can find out how many beds the facility has. If not, just do this. Go to Google, Zoom, and you can go to their website directly and they'll tell you, they'll tell you how many beds that facility has. So you want to know, so it looks like the capacity is 126. So you want to know as much information as possible about the facility before placing the call. So once I saw this information, I read through some of the details around staffing, health inspections, and got some information from, the owners and did some research there. I would then go to Google and do just what we did here. This is Bing, Google, whatever. Put the title in there and get a capacity to kind of get an idea of how many beds that facility could be. And then, of course, here you can look at other things, more visual, more images, um, their stars, the Yelp ratings, different ratings, and reviews, if you so desire. And it looks like they may be affiliated with a bigger company. And this is why it's important to kind of do some of that research ahead of time so that you can know, hey, maybe I shouldn't call the facility directly. Maybe I need to call this company. So it's Communicare, a family of companies. So this might be something to take into consideration. But assuming that it's not the case, that they are a standalone organization, before placing the phone call, I would do this. And that's copying and pasting again, going to your LinkedIn page and doing this. And this will answer the question a lot of people have around who to talk to. So you always, of course, want to talk to people who are decision makers, people who can give you information, who can provide insight, point you in the right direction, and do so quickly. So if we look here, all I did was put in the healthcare center and we already have one pretty good hit. The only difference is this person is a past, so they formerly worked for this particular company. So she may or may not be of any real help. And then if you go through, you see that it looks like they are affiliated with this Communicare Health Services. So maybe when you have the conversation with one of the decision makers, and we'll kind of drill down and see what we can find, you can ask, well, do I need to connect with someone at your corporate office, which looks like it's Communicare Health Services. So let's take a look at that first, and then we'll go back and check out, see if we can find some people. So here we've already kind of hit a good point, which is, looks like Communicare Health Services is based out of Ohio. So I would assume that they have a few different properties. And then here are some of the employees. And then some of the job posting that we saw earlier. So let's go back, because that's a little bit too broad of information to work with. But so let's drill down a little bit. So we have this one person at the top that's worked with them, right? And then I would look to see if there's anybody else that comes up under your search results that have worked at this facility. So we have a phlebotomist here, and then you check, hey, LinkedIn member, Pikesville, it's Maryland. You want to make sure that it makes sense. So like some of these people here that have come up in Alpharetta, Marietta, Georgia, Missouri, 9 times out of 10, these people didn't work at that particular facility. But we know that this lady did. So let's go to click here and see if we can get some information. It looks like she worked there as a staffing coordinator, which are always good people to talk to. And she also worked as a admissions director. So from what's listed here, it looks like she's no longer working there. So we're going to go up to her connection and maybe see if we can make some connections there. But before we do that, let's see if they have their own page. Okay, so it looks like they don't quite have their own page out here. And guys, this takes like 15 minutes. You're doing no different than you would search to find when the latest movie is coming out. You just kind of move around a little bit. So it looks like they don't have their own page. They just have that corporate page. And then let's go back. And then the next thing I would do, since they don't have their own page, is look at her mutual connection. So I think this connection is connected to me, but let's take a look at it anyway. Okay, so this is definitely a connection to me. This isn't a connection to that young lady. So let's go back and then let's go to the next page and see if there's anybody else. So it appears that you're kind of getting further and further away from our initial thought process, but don't give up yet. Okay. What you can do to kind of narrow down that result, because it's a lot, is put the city or the state in and see if that gives you more information. Okay. It looks like we're not really making any progress there, and that's fine. We're gonna go to another company that we actually did make progress in. So in this instance, I would probably just go back to the Medicare website and then just place the call. So the people or the titles that you really want to think about when you're placing calls are administrators, DONs, nurse supervisors, along with staffing coordinators or human resources type. All of those people are great people to start with to at least give you some initial information. I would include a question around whether or not it's something that you have to bring to the larger, it looks like parent company, which was Commune Care, and kind of go from there. So this one I would say is probably still in the code category. But let's go back because we did find one that worked here, and it was the Deer's Head Center. But before we get to Deer's Head Center, I wanted to talk a little bit about what this little hand means. And what this means is that they have or have been cited for abuse. So that's something to kind of be, I'm not going to say wary of, but mindful of. And I wouldn't pick this place for those reasons. So they still have 2 stars. It looks like maybe they're not struggling with staffing. But usually in situations of abuse or neglect, there is some sort of staffing or management issue. I would actually pass on this one because of this. And this little hand stays up. I'm not sure how long it stays up or is connected to your facility, but I would probably pass on this one because the next one is the one that'll work best for us. And then if you click on it, it'll bring up this little alert. And if you go into the reports, I think they have more information about what exactly happened. So on to lucky number 3. So this one is the one that I think we're going to get the best hit off of, and we're going to try it and see what happens. So Deer Head. So once again, Deer Head Center has great reviews. So when I say start with the one with the lowest star, it's not to say that you can't reach out to the ones that have 4 or 5 stars like this one does. And sometimes this one ends up being your really great facilities and great opportunities. I say start with the lowest star just because more than likely they have staffing issues. But even facilities that have no staffing issues from a Medicare standpoint of view still have staffing needs. So I would not reach out, but they wouldn't be the priority. So we've started with the 1 star, we've gone to the 2 star, and we're going to also look at this one. I encourage people, look at all the details, look at the location, view the inspections, any issues, definitely look at the ownership details. It looks like this one is a state-run facility, which is probably why they have such great staffing. As you see here, legal business name, owner is the state, controller of the state of Maryland. If you want to look at the location, that's fine. If it's not far, I encourage people to go check it out in person. And that just really helps with having the conversation with potential candidates as well. So we looked at those things, we looked at location. Now on to the next step, which is copy and paste. We're just gonna copy and paste, guys. The facility's name, Google, Bing, whatever. It is in Salisbury, Maryland. So all facilities, different places have ways or locations that they actually do reviews. So this is Yelp or Bing. Google has reviews. So there's lots of different reviews. So this place has pretty decent, consistent reviews, which isn't a bad thing. You look here, as we mentioned, we now know that it is a part of the state of Maryland, Deer Head Hospital Center. So it has some information here about them. And then if you click on it, you probably can find out what types of hospital, what type of hospital it is, it's Joint Commission, or what type of hospital that they focus on. So that's good information. Next, we're going back to where we started, guys. And on this one, I think we got a much better hit. And what makes this one nicer, and this is like your ideal situation, is that one, we did get a good hit. So not only are we looking at here, the nursing supervisor at Deer's Head Center, we also see the chief operating officer at Deer's Head Hospital Center. This person is located in the same city. This person is located in probably a nearby city. And then the chief nursing officer at Deer Head Hospital Center. So all of these are great people to connect with. But before you connect, let's make sure they still work there. So usually people who have LinkedIn profiles keep it pretty up to date. It's not a guarantee, but it's a strong possibility. So it looks like this person is still working at Deer Head Center. And let's do the other two people. She's the nursing supervisor. It looks like she's still working at Deer Head Hospital as well. And then it looks like she's also worked as a chief talent officer. So typically talent officer is what they say it is here. So it's a human resources person. So she's probably a good person to connect with. And then of course, this person as well is still working there. And then this person also worked as a ADON, and it looks like was promoted to chief nursing officer. So any of these people are good people to reach out to. This is a strategy I would use, is for those that you're connecting with or that you're able to connect with them first. Don't just jump in and connect and send a message and talk to them. Connect with them. I would first also reach out to the person that has an image. So usually people who have images are actually still active or more active or most active. Prior to connecting with them, or as you go along with connecting with them, see if there's any information. This isn't the same thing, separate entity from Deer Head Hospital Center. So even though it's the same title in the same city, it says here Deer Head Center Foundation is a separate entity from Deer Head Hospital Center. So we're looking for Deer Head Hospital Center. Right. And if you click on it, it looks like their page isn't very active. That's fine. Go back to her. So if I was to pick out of the three who I would talk to, it would be either this person or this person. But before talking to them, I would want to connect. And if you're not that familiar with LinkedIn, a connection is just really kind of like sharing a business card without having a conversation, is how I'll explain it. But it's not something where I make all types of connections. I think these notifications we see here are a bunch of connections, and people connect with me as a form of we have some common interests. I would give it a day or so, do a little bit of research. I would definitely go out to Indeed to see if they currently have any openings, and what types of openings they have in place, because you want to really remember that you typically only have about 5-10 minutes max to do your sales pitch with a potential client. So you want to make sure that you have as much information as possible as far as where that organization is. So when I say that, I'm saying, hey, are they in need of night shift nurses? Are they in need of weekend nurses? Are they rolling a recruitment or a relocation bonus? You want to have all that information and incorporate that into your sales pitch, because it's important that you set yourself apart. And the only way that you really can set yourself apart in this piece or in these types of settings is that you have the information. So you've looked at Medicare.gov, you know that they have good ratings, you know that they have good ratings online. So overall, the quality of the facility is good, but they may have, still have needs for staff. Um, so if I had to reach out to anybody, I would reach out to this person first. I would first connect with her. And you may be surprised, there may be connections or mutual connections like we saw in the other one that you guys have. So that's always a great starting point. And then I believe the way she has her set up, which is the way a lot of people do, is once you make the connection, then you have the opportunity to actually message her. So because of the little lockbox that we see here, you can't just outright message people, which is a good thing because sometimes when you don't lock it, you get a lot of unnecessary solicitation, which just creates more things that you have to go through to or filter through to read. So you want to make it as easy as possible. You connect, give her opportunity to look at your page, because your page looks fantastic. You're saying you're staffing in Maryland. You're saying you're staffing long-term care, LTAC hospitals, all these different types of specialties. You're active on your LinkedIn page with information about what's happening in your business, even if it's not open yet. And you're presenting your business in the best light possible. So from that point, after making the connection, as far as sending messages, you want to, one, allow them to check out your page, which thankfully LinkedIn tells you when people check out your page for them to initiate the connection. But after a week or so, a couple of days, there's nothing wrong with doing like a warm outreach. Something that says, hey, I offer staffing services in your area. I'd love to set up a time to talk more with you about some of your needs that your organization might have. Another way may say, hey, I'm a small business owner in your area. I'm a nurse-owned staffing agency in your area. I would love to connect and take out some time to find out more about how your organization works. So there's a lot of different ways that you can structure the conversation, but you want to make sure that you've provided a lot of information on your LinkedIn page so that it's clear as to what it is that you're doing. So you don't want to necessarily get on the phone and have to explain fully what you do as much as kind of touch on the highlights that, talks about what makes you different, why they should work with you, some of your specialties, or, the area that you thrive the most in the staffing arena. And then, of course, that's kind of how you go through and really move people through the process. I think we saw 3 different ones that had 3 different experiences. And that's how I moved to get people from cold to warm, because reaching out, blindly calling, that's what we had to do in the situation, many times doesn't get you that far. Reaching out to facilities that may have, whether it be organizational issues, financial issues, isn't always the best way to go. But also reaching out to facilities where you have names. So from the point that I maybe made the outreach to her and maybe I didn't get a response, I have a name now. So I know Vivian West is a nurse supervisor at that facility. So when I make the decision to call, I can ask for Vivian West, I can ask for Luann DeShield, and potentially get them on the phone or get their direct voicemail and leave a message to share a little bit of information about my agency. So those are all the steps that I take. Like I said, I still use and would still encourage people to use Medicare.gov. The difference in the strategy is that I delve a little bit deeper into LinkedIn. And then the other thing is once you make connections with certain people, then you'll start to see the list we saw here where it'll say, hey, people that you may also know. So this person, Erica Frazier, is the Chief Nursing Officer. Let's click on her and see. In Winston-Salem, North Carolina, at Encompass Health. So once you kind of start the process, you'll kind of be keyed into other people that have similar positions. This person works at DaVita. this person works at Novent Health Rehab Hospital. So that kind of opens more doors for you to make more connections, which could potentially open the door for more clients. So I hope that was helpful to everybody. I hope that's something that you'll try and use. The only factor I would say is I would stay away from these initially, and then you may, depending on where you're living, have to bring your radius out a little bit further than the traditional 25. Or if you're in larger metropolitan areas, you may want to bring it in a little bit closer to kind of get a list. But the nice thing about this page, this Medicare.gov page, is that you can sort it however you want to. So you can sort it where you just see all the ones or the ones and the twos, star ratings. As I mentioned here, they have a little link here that kind of tells you what the star rating means and how it works. You can do it by the number of beds if you want to work with smaller facilities. Let's see if we can get something here. Where they have less beds, or let's see, or if they have more beds, the same thing applies, right? So, and then once you kind of find an area to say, hey, I want to work like in this location or this area, you can always print this information. So kind of like I printed the information about the business, you can print it here. You can save it as a PDF. You can convert it over into Excel. So you can do a couple of different things to make it easier for you to maneuver through it. And since we're on here, I'm going to touch a little bit about doing a little bit digging on the actual companies. And I wouldn't necessarily do this until you have a contact and you're making some headway with the client, just for time purposes. So let's go back to where we were. And I believe we did it for Anchorage because Deerhead's is a state-run hospital. But to just kind of do some research, same thing, ownership details. This is really nice. You can go and look here and just Google WO Holdings LLC. It's not anything in depth like some of the funding companies may do, but just to kind of get a history. Hey, you know, they may be located in Wisconsin. They may have business in these different states. So it's just an informational thing. It's nothing deep or in depth. It's good to make sure that before you sign contracts with facilities that you've done a report, which I know Amanda at Plex and some other funding companies do, to make sure how good of a payer they are so that you don't end up in those types of situations. But this just has some information about who owns the company. I think this one also had the CommuCare connected to it, and that might be what all these other organizations are about. So it's just good information. You have more names. And it's also good information to have just in case something goes wrong. So like I said, I wouldn't really focus on this as much early on as, you know, kind of narrowing it down. The other question is, well, how often should you call? At minimum, 10 to 15 calls a day as a business owner. So like as a NOSA, because you have a lot of other things to focus on. 10 to 15 calls a day. I wouldn't call necessarily on Monday morning or Friday mornings because that's when most places have a lot of their meetings. So you want to be time sensitive. Also, if you are reaching out to a place and you get like receptionist types, like you're not necessarily getting the nursing facilities, make sure to remember names. More and more facilities are making sure that their staff, you know, uses their name when they call, especially when they're calling from the outside. So make sure that note names, or if they're forwarding you on to someone, make sure that you ask to capture the name or ask, well, can you tell me the name of the human resources manager or staffing coordinator. So those are all good things and good tips to take into consideration. Like I mentioned in the old video, now that we're more outside as a country, you want to connect with your chamber of commerce. You want to connect with your local school, your local small business development centers. If you're a part of any of the SBA smaller programs like the Women-Owned Business Enterprise, there's so many things, and a great place to look for a lot of those things that might be happening around small business, with the exception of those, is your state. So like your state will have different things. SCORE has a plethora of information virtually and in person. Libraries. I mentioned before, I used to, early on in our business, the Small Business Development Center hosted something at the local library every Wednesday from 12 to 1. So guess where I was hanging out every Wednesday from 12 to 1. And it's not so much just about getting the information that they're sharing, because sometimes the information isn't necessarily applicable to me or what I'm doing, but it's about connecting to the community, meeting people in your communities, in your respective communities, talking to decision makers around state funded or nonprofit organizations, how they may be able to help your business grow and thrive. So kind of getting your feet out there is really key and important. Reaching back to old employers, old supervisors, friends, family, relatives that may be in that role, as well as sharing, and that's why I mentioned the social media piece, is sharing with others what you're doing. You'll be surprised, one, about the level of support that you'll get, but you'll also be surprised about the fact that a lot of people have connections. So like healthcare is big, which means at least one person in every circle knows someone in healthcare. So, sharing what you're doing is a great way to open doors for you in the future. So thanks for hanging out with me, guys. I hope that helps. I hope that provides you with a little bit more insight, a few more steps. That has been the most effective way for us as an agency owner and for other nurses to get clients. And the key piece to that is the LinkedIn piece. There are a lot of virtual assistants, and I encourage you to kind of focus your virtual assistants or even project related assistants in that area where they can dig and do a lot of data mining in LinkedIn for you, because most people who are on LinkedIn are a lot of your decision makers, a lot of your employers. So you just want to go where they hang out and get your information there. There are LinkedIn specialists and things like that. As far as like paying for some of the additional features that LinkedIn has, that's not something that we did or we currently do, because as you guys saw, it took me 10 minutes to kind of get at least a contact name, which gets you a lot further than just cold calling. And that's why I said warm calling. And from there, even if you get a chance to leave a voicemail with her, that's even better than kind of being directed to other individuals who aren't decision makers. I would say, make sure that you're consistent, make sure that you're keeping track, whether you're keeping track via an Excel spreadsheet, which is something we did early on, and there's nothing wrong with that, and it's super affordable, or a CRM, which is also a great option. And a lot of your CRM companies, client relationship manager is what CRM stands for, or management, offer free services. So if you can get a free option of a CRM, use that, because it also helps to automate some of that keeping connected, keep in touch with potential clients. So if you reach out, you don't get anywhere, you kind of are able to automatically say, hey, in 3 months, send this person a happy Thanksgiving or happy holidays email message, or remind me to reach out around that time. So those are all good points to move into. And then as you grow as a business, you can always purchase the paid options for some of your more popular CRM office suites. The other thing is, it's the holiday season. It's around the corner. And we know what happens during the holidays. There's a lot of opportunity for placement. So just like everybody else, healthcare professionals like to take off during the holidays. So this is a great time to rev up any sort of campaigning or outreaching or calling or whatever you refer to it as, connecting with your clients, this is a great time to kind of reconnect, connect, outreach, even host or do any sort of special events with them or activities with them, to let them know, hey, we appreciate your business, or hey, we're interested in more business. Around this time, it's a need, unfortunately, that happens every year for the healthcare industry, and it hasn't changed. And you kind of being the solution to that is a great way to put it when talking and selling your business to clients, is that, hey, we're a great solution. And it could be in the per diem realm, the local travel contract realm, as well as the permanent placement realm. So don't close doors that you don't have to. You 100% can place people permanently. So look at all your options and alternatives when it comes to staffing during this past quarter, this upcoming fourth quarter. And keep me posted. So let me know if this video helps. As always, if you like the video, make sure to subscribe here. Give it a thumbs up if you like it, and then hit the alarm bell if you want to hear about new upcoming videos that come out. Thank you, and I'll be chatting with you.